My name's Trevor. I'm from England, and I've got Leber's neuropathy, optic neuropathy. I lost my eyesight 8 years ago. The right eye went first. It went quite cloudy, misty. I went to the hospital. They said I'd got a stroke of the optic nerve, and that I wouldn't be able to have an operation, but the left eye would get stronger, so I'd be fine. 2 weeks later, the left eye went to the same. I went back to the hospital. They tried to diagnose what I'd got. They tried MS. They tried me for different diseases because I'd been to quite a lot of tropical countries. They couldn't find anything wrong with me. They was a bit puzzled why I'd lost my eyesight. So they tested me for Leber's disease through blood tests, and it come back negative. So then we done some research, and I went to the Tropical Disease Hospital in London, where I met a consultant, ophthalmologist, neurologist, and he said I'd actually got Leber's disease. But I told him that I'd already been tested for Leber's disease, but he was convinced I had got Leber's disease. So he then referred me to the University College Hospital in London, the UCL, where he'd done more tests. He still couldn't actually find out that I did have Leber's disease. So he took some blood tests and he sent them to France because they're leading in DNA blood testing. The blood tests come back negative, so he was quite puzzled then. So he then said, he sent me to Moorfields Hospital in London for the eye clinic there, because he thought the electrics between my brain and my eye had failed. They done tests there, come back negative again. So he was now getting really puzzled, but he said, I will find out what's wrong with you. I will get to the bottom of it. Then he said he wanted to test my DNA through the microbiologist in UCL London, and he said it would take probably 12 months. It would be from A to Z. He would go through to see if there's anything else wrong with me. 12 months later, I went to see him. He said the microbiologist team had found something, and they didn't quite know what it was, but they wanted to do a muscle biopsy to see whether they could find out what it was. So I went to have a muscle biopsy. After that, he come back to me and said I actually had Leber's disease, and the reason it took so long to find it was because it was a very, very rare form of Leber's disease. After that, I was quite shocked, because when I asked him if there was any cure, he said no. So my world sort of fell apart then. He said there was no clinical trials I could go on. I did ask him about stem cell. Unfortunately, he said they don't do it in England at the moment because they are worried about sort of like other things like cancer. They hadn't quite got to get to grips with it at the moment. So I accepted it a little bit and I went on, but then I found life getting a bit sort of, couldn't cope with life with only peripheral eyesight. So my wife done some research on the internet about stem cell. She come up with tour to India, and they advised us that Advanced Cell would probably be interested in doing a test on me. Told the consultant in London. He said he couldn't sort of say yes or no, but he didn't sort of he didn't discourage me from going to India. So we done the research. We come to India. come to the hospital, advanced cell sorting, all the not travel arrangements, we've done that ourselves, but the hotel picked us up from the airport, took us to the hotel, took us to the hospital, seen a consultant for a consultation, which was very good. She told me stem cell was probably my only option. So I went to have the operation on the Saturday. It was I didn't feel any pain, just discomfort. I went to see the consultant 40 hours after, and she admitted that I was seeing better than I did before. She done a test on my eyes. When I first seen her, the optic disc was white, no blood cells to it. After she done it, tested me 48 hours after, the optic disc was getting pink. So she thought there was a blood supply going to my disc. I feel personally that I have seen a little bit better since I've had the stem cell, and I think my wife agrees as well that I have, because I'm seeing things before that I didn't see. I actually have been able to read, not small print, but a certain print that I couldn't read before. So I am quite confident that this is going to work for me. I'm travelling here today. We actually passed a Royal Enfield motorbike, and I actually picked up on the side of the tank that it said Royal Enfield, and the colours were red and cream. When I lost my eyesight, I couldn't see colours. The only colour I could see was blue, and that's because the optic nerve, when you lose your optic nerve, you do see blue. When it first happened to me, all I could see was blue dots. When I closed my eyes and opened my eyes, I could see lots and lots of blue dots in front of my eyes. So, and I've started picking colours up a little bit now. When I looked at sort of yellow, it looked orange. When I looked at red, it looked green. But my wife bought a top in the mall the other day, which was mustard, and I actually could see that it was mustard, and I said, that's mustard. Before it would have looked orange to me. So I think there is a little bit of something working. Something else that sort of happened to me when I lost my eyesight, sunlight, bright light, I couldn't see very well. But in the dark, when it was not at night, I could actually see better in the dark than I can in the daylight. So I wear dark glasses in the sunlight. I would encourage people to try stem cell.